testing technologies and in assisting startup stage companies implement their regulatory, quality, and clinical study functions. And now I'd like to hand over to the speaker, Ms. Sheila Ramerman. Over to you, ma'am.
Thank you very much, moderator, and thank you folks for attending this overview of the unique device identifier requirements. And we'll get right to it because there's lots of information here and I think folks are very interested in it. There we go. So the topics today are going to be some background information defining what is a unique device identifier, what's the standardized date format, because the two requirements travel together as it were. A few words about how UDI is different from traceability and tracking, just because some folks think that their device is required to have tracking, they're exempt from UDI. Then we'll get into the requirements, who must comply with it, what's required and when, both for UDIs and the standardized date format. A little bit of information on the Global Unique Device Identifier Database, or GUID. Accrediting agencies for UDI, which are the folks that you will work with to implement UDIs on your labels, and then some information that FDA has published on the benefits of UDI. We also have received lots of questions beforehand, and we do have time at the end of the webinar for questions and answers, so we'll get to those after we go through the material. So background on the unique device identifiers. They're defined at 21 CFR 801.3, which are the general medical device labeling regulations. The requirements are found at 21 CFR 830.20, and in short, those regulations and requirements require that most medical devices bear the UDI on their label. Okay, that's great. What exactly does that mean? So, a unique device identifier, as defined at 801.3, is written here. It's composed of two components. There's a device identifier, referred to as the DI, which is a mandatory fixed portion that identifies a specific version or model number of a device and the labeler of the device, as well as a production identifier, or PI, which is a conditional variable portion that identifies one or more of the following things in the laundry list thing here that's listed here: the lot or batch within which the device is manufactured, a serial number, an expiration date if it has one, the date a specific device was manufactured, and for human cellular tissue products that are regulated as devices, the distinct identification code that's required under those applicable regulations. So a UDI consists of the device identifier and the production identifier. What's this thing called a standardized date format? Sometimes this gets lost in all the commotion around the UDI requirements, but it was put into place at the same time as the UDI regulations were. Standardized date format is required for all medical device labels and labeling, whether a UDI is required or not. And I've put the CFR citation there, 801.18, that talks about standardized date formats. What this means is every medical device labeling has to use the required format that's shown there, the 4-digit year, with a dash, 2-digit for the month, a dash, and 2 digits for the day. So, for example, September 24th, 2013, in the standardized date format is 2013-09-24. If your device is required to have a unique device identifier, then your label must conform to the standardized date format at the same time that your UDI requirement kicks in. If you're not required to have a UDI on your label must conform to the standardized date format by December 23rd, 2013.